Welcome to the Wistar Institute Women and Science Spring 2023 program. My name is Jessie Villanueva, and I am an associate professor in the Molecular and Cellular Oncogenesis program and the Ellen and Ronald Kaplan Cancer Center, Associate Director for Diversity, Equity, and Inclusion. I am delighted to have you all with us this evening for a special presentation. Please allow me to begin by thanking our Women in Science Committee and my scientific program co-advisor, Dr. Amelia Escolano, whom you will meet toward the end of the program for our question and answer section. I would also like to thank our lead sponsors, Martha and Robert Adelson, and all of you who have so generously contributed to this initiative and the Wistar Institute. The Women in Science program at Wistar aims to showcase contributions made to biomedical research by women scientists, recognize the challenges we face, and celebrate our accomplishments. With that in mind, it's truly an honor to introduce tonight's distinguished speaker, internationally recognized vaccinologist, global health advocate, and my friend, Dr. Elena Bottazzi. Dr. Bottazzi serves as the co-director of the Texas Children's Hospital Center for Vaccine Development. She is the Senior Associate Dean of the National School of Tropical Medicine and Division Chief of Pediatric Tropical Medicine at Baylor College of Medicine. As a prominent figure in the global scientific community, Dr. Bottazzi has authored more than 230 scientific papers and has been recognized by a long list of national and international honors and awards. Just to share a few highlights from her career, Dr. Bottazzi is the recipient of the Carlos Slim Foundation Health Award for Lifetime Achievement in Research and the League of the United Latin American Citizens 2022 National Service Award. She has been named by Forbes magazine since 2020 one of the 100 most powerful women in Central America for 3 consecutive years. She has dedicated her career to advance global health and equity, which led to her Nobel Peace Prize nomination for her work developing a patent-free COVID-19 vaccine, which has saved millions of lives. Her life's work advancing scientific research and developing affordable vaccines that improve the health of underserved populations has helped combat devastating impact of neglected tropical diseases, which affect over 1 billion people worldwide. Her work has contributed significantly towards reducing health disparities and promoting peace and stability in affected regions. Before I turn the screen over to our distinguished speaker, let me mention that following the presentation, we will have a question and answer session. Please add any questions you might have to the Q&A section at the bottom of the screen. We will do our best to answer them. Thank you so much, Maria Elena, for joining us today. Please take it away.
Thank you. Thank you, Jessie. Thank you for inviting me today to speak to all of you and tell you a little bit about the story of myself as a woman and a woman in science. And I hope that you find it not only inspirational, but encouraging to many of you that maybe are interested in entering a pathway of a career in science. So I'm going to actually share my screen and start with my presentation. All right, so I'm going to actually minimize the photograph so that I don't see anybody. Okay, so today I thought that I would, as I give you a little bit of my story, I wanted to introduce you to what is tropical medicine, of course, and how tropical medicine can be a catalyzer, a very powerful catalyzer of achieving equity, and achieving equity, especially in the field of the vaccine sciences. I have to show you my disclosure slides, which is not advancing for some reason. It's not working. Okay, I just click here then. Okay, apologies for that. Just my slide of disclosures, but I really want to get right into a little bit about who I am. So I thought it may be interesting for you to understand a little bit about my personality. In fact, if I go through the Myers-Briggs and to try to identify, who I am. I am considered extrovert, very sensitive, thinker, perceiver, and in fact, I think I can be categorized, and I feel myself as a rebel talent. I am definitely a person who is a troubleshooter, a persuader. I'm adaptable, clever, curious. I certainly think I can show you that I can roll with changes. And if anybody is really interested a little bit about this concept of rebel talent, there is a wonderful book written by a colleague in Francesca Gino, who really provides you some quite compelling idea of why certainly in any field, but very especially we scientists are the epitome of rebel talents. And in fact, if you look at other rebel talents, Malcolm X is considered a rebel talent, Captain Jack Sparrow is considered a rebel talent, and even Al Capone. And they all share, like me, this ESTP personality. And so what does that really mean? It means I grew up in Honduras. I studied microbiology. I was very fortunate to come to the United States and go to the University of Florida, which then led for me to start, advanced graduate studies and postdoctoral studies, including the University of Miami. And then, since we are in Philadelphia, this is very dear to me because I spent many years here, not only as a postdoc at the University of Pennsylvania, but it was one of those seminal moments where I think my talent really surfaced, which was intersecting the science with business, and where I actually had the opportunity of taking some business classes within the Fox School at Temple University. And then after I finished, of course, my training, my initial appointment as an academic was at the George Washington University. I built a career there in 11 years. And now, of course, I'm 11 years also now at Baylor College of Medicine and Texas Children's Hospital in Texas. But around all this training and all this, career background, in education and achieving all these skills, I was very interested, since I was very little, very interested in the so-called parasitic worm infections. And what are these parasitic worms? And they really do a lot of very strange things. So, for example, they're actually called helminths. They're also called the worms that are transmitted through soil. There are large macroparasites, and as you can see in this depiction, they usually come into our bodies through either the intestinal tract, they can go to the brain, they can go through the skin, and they can even reside in blood vessels. They have many names. Sometimes they're actually quite interesting and complicated names, like roundworm, whipworm, hookworm, tapeworm. But the key signature of these parasitic worms, and the reason why I was very interested, is they're very endemic worldwide, very prevalent among the poor, very chronic. They cause a lot of morbidity, meaning they don't really kill people. They really live with us, but keep us in a state of health that is certainly not ideal. Sometimes they can be quite stigmatizing, and they can cause a lot of disability, including growth delays, blindness, disfigurement. So with that interest, in fact, when I was at the University of Honduras, I also saw that many of these worms, this is, for example, one of these parasitic worms that not only cause intestinal disease, but they actually cause very serious mental, neurological impact in the brain. In fact, there is a very big link between neurology and this parasite cysticercosis, which ultimately leads to mental health issues. And very honestly, there's not a lot of options for diagnosing it, especially diagnosing it in the low income country settings where you don't have a lot of technologies like imaging, and it's very rare to actually identify it in the population. So this, as you can see, triggered my interest in not only understanding these parasites, understanding the diseases they can cause in the human host or even in the animal host, but how do you find technologies to better diagnose them, to better treat them if you get them, or even to prevent them, and hence, using drugs, vaccines, or diagnostic tools. So tropical medicine then, what is tropical medicine? And it's really is a field of expertise that certainly look at all these parasites and these microbes that specifically also are quite centered in populations that are usually underserved, that they are underrepresented, that they don't have access to health, that they also may lack access to education. And now, even within the global framework, for example, from the WHO or the World Health Organization, we know that they are even a big body of different diseases that we can study with this discipline of tropical medicine, which include not only 17 tropical infectious diseases, but also now what we call the emerging infections. Very, again, prevalent in the poor. They also promote poverty. They, even though you may think that they only can exist in populations that are in poor countries, believe it or not, the majority of these diseases also occur in poor populations, but that live in high-income countries, including here in the United States. In fact, most of the burden of the disparities occur in populations, of course, that are poor, underserved, underrepresented, Indian American populations, African American populations, Hispanic populations, that unfortunately still we have huge disparities. Another signature is they burden a lot our children. These are diseases that usually you get when you're very early in childhood, and then go with you, and they basically live with you all the way until you're an elderly person. It also is very important, burdening a lot of women, and therefore have a huge impact in maternal and child care. As I said, they're not necessarily new, they're very ancient and neglected afflictions, chronic, stigmatizing, disabling. And one thing that we have to remember is, usually these parasitic or tropical diseases and the study of tropical medicine is the fact that you see a lot of what we call co-endemicity. So an individual may have multiple diseases at the same time. And therefore, the pairing of the endemicity of these diseases with others like malaria, HIV, and others, really can exacerbate or make them even worse. We now even can quantify the number of years somebody can lose because they live in disability, and that is what we call the DALYs, the disability adjusted life years. And as you can see, these tropical diseases can cause millions of years lost because people live with some disability. We also know that if somebody lives in disability, they're clearly not very productive in society. They do not really study well. They may not have jobs. That's the cycle of poverty, and even can cause a lot of productivity losses because of healthcare costs to try to attend to these populations. And therefore, it maintains many countries where their economic productivity could be improved, but they can't because their populations are primarily poor and disabled because of these diseases. And one aspect that we want to make sure that it's also important is it's not only human health. Many of these, not only parasites or microbes, are affecting us as humans, but they also have an ecosystem where they can infect other components in the world, not only environmental, but also animal. They have, hosts that maintain the cycle of these microbes. And they also, many of them are transmitted through vectors like mosquitoes, or even some of these ticks, or even some of these bugs, as you see in the picture. So a couple of examples. I said, the importance of, where there is contribution of the severity of diseases. So take, for example, a parasite called hookworm. And the word says it's a worm that, unfortunately, it hooks into your intestine, and unfortunately, they feed on blood. And so you would think that by feeding on blood, they of course cause very severe anemia. We now know that, for example, if you not only have anemia because of hookworm, or also because you have another parasite like malaria, and on top you add, for example, even malnutrition, because they of course are in kids that already live in these precarious areas, we see that you can have an enormous burden on the child development, not only in growth, but also in their ability to develop mentally and cognitively. So you actually see some mental retardation. So it's not only anemia, but it's also the silent impact of mental disease. We see, for example, how they can superimpose these diseases. In the map, you see that everywhere where it's green is where you actually find both hookworm and malaria, and therefore you can see that there's a huge adjusted burden of anemia, because when you have both parasites affecting the population at the same time. Another example is this other parasite, and many of them, as you see, have very interesting and difficult names to pronounce. This is Schistosomiasis. This is another one of these parasitic worms. There are two types. One is an intestinal schistosome that also, as you can see, has a huge bearing on blood loss and anemia. And also we have another type of schistosomiasis that is urogenital, and it actually is very co-endemic in areas where you have high prevalence of HIV or AIDS. And that's the reason why many of these tropical diseases and the study of them usually have to be integrated approaches, and keeping in mind of the whole landscape of what other diseases and what other factors you have surrounding the population. So in fact, to tackle many of these challenges, including these neglected or tropical diseases, early in the turn of the century, the United Nations actually set forth some very audacious goals. They were called the Millennium Development Goals. The target was that they were going to try to address many challenges in the area of not only reducing hunger and poverty, improving education, increasing better health for children, reducing mortality, of course, maternal health, development of interventions to combat infectious diseases like malaria, HIV, and tropical infections, certainly look at the environment. And it was going to tackle in a 15-year period from the year 2000 to the year 2015, many of these goals. And in this slide, you can see how through a color code, now that we know what happened between 2000 and 2015, that we actually achieved some remarkable improvements, not only in goal 4, which was to reduce child mortality, but also how to improve maternal health. We did maybe, in some areas not as good with HIV, AIDS, and, tuberculosis, but for the most part, we were very encouraged to see that these goals were being tackled all over the world, driven by the political will and the will of all the governments and all the United Nations. In fact, there was one goal that was very interesting too, which was the goal number 8 that actually called upon tackling all these activities with an attempt of doing it in partnership. And the realization that for us to really converge and really reduce global health burdens or just any challenge around the world, the ideal is to actually work together, form trusted and partnerships. An example is, the foundation that was spearheaded also in the turn of the century, the Bill and Melinda Gates Foundation, that really predicated in building funding mechanisms that they would be given to partnerships that would tackle, HIV/AIDS, TB, malaria, the neglected infections, diarrheal diseases, respiratory diseases. But as long as you work in partnership approaches, and many of these organizations that were formed are highlighted in this slide with their acronyms. One of them, which I thought was brilliant, was even if you have all these interventions, how do you get them to the people that need them? And in the case of vaccines, it was very important to enable access to the vaccines at not only in quantity, but at low costs, affordable, so that governments can actually sustain the programs of immunization in those countries. And the Global Alliance for Vaccines was created that really helped, bring together producers, countries, policies, so that vaccines would be achievable in their distribution, and that they would really enable countries to afford them so that they could have robust vaccine programs. So we had some great successes in the area of tropical and medicine and tropical diseases. There were many diseases that are being tackled. As I said, there are more than 12, 15, 20 diseases. Most of them used combination approaches, like, for example, using medicines to mass administer in the populations. We had some great gainings with some of these diseases. Sometimes, we improve the way that we detect them, right? By case detection, by even vector control, by really identifying where are the diseases. Water sanitation, WASH, is very important. Other approaches too, in certain cases, also controlling some of the vectors and some of the infrastructure and the dwellings. Unfortunately, we not only had great gains, but we also had many failures. And recognizing that many of these diseases and their microbes are very complicated, very complex. Sometimes the populations are hard to reach. Many times these interventions are not long-term. They're short-term solutions, but not long-term solutions. And we started seeing that, we were losing the battle, especially with some of these neglected diseases that use vectors to transmit them, or that, clearly we were not improving the health of the individuals. And I think that's where our group, so, I represent a big group, a lot of, teams that we try to use academic and hospital-based infrastructure. So we live in a university, in Baylor College of Medicine, aligned with a health system, a pediatric health system. And now, as you know, the pediatric hospitals extend into maternal health and even adult health, because the child, eventually grows to be a young adolescent before, of course, they go into adulthood. And we have set up a structure where we tackle tropical medicine, not only at a school level with our National School of Tropical Medicine, but also within a division of pediatric tropical medicine, and then, of course, creating a center of vaccine development. And our mission, it's really to do cross-cutting research in all areas of tropical medicine, focusing, of course, in as many as we can, but selecting a few, like, some of these parasitic worms that I showed you before, building models to not only design new technologies, integrate solutions that would really support improvement of population health, looking intentionally at how they can be integrated into regulatory or policy frameworks. Certainly, they have to be affordable and accessible, so that anybody and everybody ideally could access them. And we, of course, primarily focus on what we call vaccine development, because we believe very firmly on preventive medicine. So it's always better to try to prevent someone from getting a disease than, of course, treating the disease. But we complement ourselves very much with those that also treat diseases. And we call these approaches linking vaccination strategies with chemotherapy or drug or medicine strategies. So the framework that then we operate, or our philosophy, it's predicated on some key basic principles, which I think, really have enabled us to achieve this concept of health in tropical medicine. Is be very open, have open science, not only in sharing our data, our information, but being really very intentional at building capacity for open science. Our teams are very diverse. Again, we are in a lecture of also diversity, right? Which it's important to bring many perspectives, bring many different disciplines and knowledge, not necessarily only in the science, but also in the mathematics, the arts, and the engineering, and certainly all the different disciplines. We want to make sure that we also are very cognizant of the needs, certainly the cultural needs, the country needs, the regional needs, the priorities. We prefer to remove man-made barriers, for example, removing any intellectual property barriers or even patent barriers. We want to be very inclusive, where we give an opportunity of equal contribution with the low middle income country collaborators, so that they don't feel like they are at a disadvantage. In fact, there's so many things we learn from them as they learn from us. So really creating this transparency, trust, solidarity, and equity. But very importantly, even though we can communicate amongst ourselves as scientists, doing things like this that I'm doing right now is, engaging with society, engaging into the dialogue, connecting with policymakers, ensuring that we're building the next generation. And certainly, of course, as everything requires funding to do so, and then looking therefore at, traditional and alternative funding strategies. So how do we do it, right? So in this, slide, I pretty much bring you a snapshot. It's very complex, but it's very interesting how you build, a little bit of the building blocks of how do you develop, technologies that you want to use for prevention or treatment or diagnosis. So we, as academics, we really leverage what academia does well, which of course is not only teaching and training, but it's this freedom of creativity, right? Where the ideas come, where we really study the concepts. Then we, however, need to learn how to translate those academic creative ideas into business practices, right? Adapting, how do you set up a proposition, right? What is your product? Bringing, a brand, experiences. So it's very important. You see this intersection again between science and business practices. As you know, all these interventions, the most important is safety, safety, safety. If especially you want to eventually see them used in people. You want to ensure that it meets and follows a very strict regulatory and quality science, accuracy, not only in your evaluations, but certainly following the policies. Of course, forging these trusted and sustainable partnerships is very important, communicating the science, and as I mentioned before, the funding. So we actually had pretty success in this, what we call the Millennium Development Goal period, right? This initial 15 years of the 21st century, we generated modest but promising pipelines of candidates for vaccine development. In fact, a few are highlighted here. You can find information in the in the publication domain that really speaks of all these diseases. So there's a lot of good information of of how we have been able to advance the field. But the reality is many things were happening during this initial 15 years of this century. And clearly we started seeing some priorities were shifting, especially after the first initial 15 years. We saw a lot more pandemic threats, even biodefense threats, future epidemics. I show you an example even from our recent experience that it's not the first time we have a coronavirus causing an outbreak or even an epidemic and pandemic, right? We've had, 3 now with COVID. There was certainly shift there in funding agencies that were really interested in ending, the role of these emerging infections and emerging threats. Organizations like Gates also recognize that, as I showed you in one of the initial slides, that mortality, especially in children below the 5 years of age, is very important. So many things were shifting. So we ourselves started to shift too and started to evaluate, what is out there that is also relatively neglected, that requires this concept of partnerships, and that we could, start to prepare ourselves in the event, again, we, see these kind of emerging infections. And we actually started working with coronaviruses very early on, even before the MERS outbreak in 2011. We used the same premise of building partnerships. You see a few logos of partners that, have worked with us for now, more than a decade on coronavirus research. We understood, how to bring a low-cost technology. We wanted to use some of our signature vaccine platforms, which of course uses fermentation using yeast. We already understood, the coronaviruses to the point where we had already targets like, the spike protein or the receptor binding domain of the spike protein. We wanted to make sure that when we build these partnerships, that we always look at scalability, producibility, the regulatory pathway, and the affordability. And in fact, we did get some good funding from, even from our government to spearhead and prepare ourselves. And as you know, if it wasn't because of all the years we've been working on SARS and MERS, that's how we could be very rapid at responding at the coronavirus COVID-19. So what did we do during the COVID-19 pandemic? So we leveraged the 10 years of data that we already had, the fact that we had what we call these starter kits, because we already were making many prototypes of COVID or SARS vaccines, MERS vaccine, and then we pivoted very rapidly into the COVID-19. So I call pretty much, we created these little boxes with, all these reagents and information that we wanted to share, right? Everybody wanted to share to, respond very rapidly. We spent many times putting together reports and recipes and assays, and we shared them through many of these share filing because we couldn't really walk to or go to places. As you know, we were kind of all locked down. And then we had, I have to tell you, tons of Zooms and Teams and meetings where, we can interact with scientists all over the world. And the idea, again, was predicated on this concept of open science. We didn't protect, so it was open. We wanted to enable mass production, and we wanted to make sure that who received our information kept these interventions as low cost as possible. So we ended up with 3 very interesting vaccine development business models for COVID. One is very traditional in academia, where you do these so-called material transfer agreements, where we basically say, here, take some of our boxes with stuff, try them out, evaluate them. And if they actually work as you think you wish to advance them, then we do a formal, we call technology transfer activity, where then eventually leads into them going through the process of licensing and creating a real vaccine. And that's really what happened with companies in India, Indonesia, and Bangladesh, where they're very established producers. They really knew what they were doing. They had prior experience. They even had not only prior experience in vaccines made in yeast. They understood the experience of bringing global products. And they really aligned with our no patent affordability and scalability vision. The second was actually totally the opposite, right? As you heard, there were a lot of challenges where many regions around the world were really not prepared So we started really understanding the need of building more vaccine development capacity. One example is the work we've been doing in Botswana, where they're actually building not only the workforce capability, but the infrastructure for the vaccine. And then what we did is actually we connected the Botswana groups that also wanted to learn from the very advanced producers, like, again, putting them in contact with the India manufacturers so that they can also not only learn from an academic perspective, but also learn from an industrial producer. And then the third scenario, which really highlights the value of doing things in the principle of open science, was, the work that we enable for Cuba. Cuba, we had a lot of limitations, of course, of, interacting directly with scientists there, but all our information was openly published and free access. And they actually read many of our scientific papers, to the point where if you look now at how the Cubans developed the Abdala vaccine, it actually was based on many of the principles of our publications, to the point where their vaccine really mimics, the formula of how we develop our COVID-19 vaccine technology. So we've been amazingly privileged of having participated not only with India and certainly in Indonesia, working with these large-scale producers. We have more than 100 million vaccinations, not only in India, but also in Indonesia. They, of course, are now working in second generation vaccines, including, of course, adapting to the different variants of COVID. We keep producing these starter kits, so we keep sending them to them so that they can continue advancing the production and, of course, the access. And one side note about Indonesia that was very special for us is, being a Muslim majority country, they also were, we were very cognizant of the cultural needs of having halal certification, which practically is, no animal derived products, they're very, specific qualifications. And we had all the documentation to support their evaluation, to enable that our technology, after it's transferred, would follow this process of being able to get certified as a halal certified vaccine. And in fact, it's probably the only vaccine for COVID that has this halal certification. And almost to end the talk is, the really importance, as you know, the communication with society, with people, it's so important. And so we really were very intentional at, where we participated, not only in public fora, media, but also certainly in consensus studies, in task forces, and really enabling, the sharing of this information so that people can be educated about what the importance of vaccines, the importance of vaccinations, the safety of the vaccines, etc. So now we are, of course, using a lot of these learnings from COVID to reflect back of how they can help us advance vaccine candidates for poor nations, but also for all these tropical diseases, all these diseases of poverty. And it's clear that we have to innovate and come up with new models of how to certainly get continuous and sustainable funding. How can we strengthen the regulatory framework globally so that, again, you can trust the interventions because they have gone through rigorous quality and safety procedures. We want to make sure that we enhance the availability of manufacturing capacity, especially in the global south. The concept of equity and access, of course, ensuring that it's not only affordable, but accessible, that there is capacity by governments and countries to not only receive the vaccines, but deploy the vaccines. And certainly as everything, have better leadership, better partnership in the decision-making, especially during crisis moments. But the challenge that I leave you is, and I hope I don't leave you on a negative note, but we are really playing a global health whack-a-mole game here, right? It's very challenging. So in fact, after 2015, the United Nations recognized that even though we had amazing gains in many of the goals, we needed to work a lot harder and even expanding many of the challenges. So from 8 development goals, now we have 17, broader, more diverse, recognizing that we have a lot of forces that also affect how especially infectious diseases are transmitted, through, of course, forces of population growth, conflict, climate change, that it's hard to address the infectious diseases when you have many of these other forces affecting. And the perfect example, the sad example, is how, in fact, taking all the gains of the initial 2019 years of these global goals and achievements, how having had COVID-19, it really has taken us back practically almost at the same levels of how we were back in the year 2000. So we've lost a lot of children that have missed their basic vaccinations. We have started to see even more deaths due to some of these diseases like tuberculosis. We clearly have seen a lot of mental health issues, especially in the healthcare workers due to burnout. So we now have even a greater challenge of how do you recover, how do you catch up what we were doing relatively well, and now in the backbone of having had and continuously still have challenges with COVID. So I'm going to stop there. Thank a lot of people, especially all the nice faces you see in that photograph, which is, our team, certainly our sponsors. And I hope that this resonates with you, that it certainly was very much anchored on academia, on the creativity of academia, but the fact that we were very strategic, very diplomatic, but it did require a lot of courage, commitment, cognizance, community, and cultural intelligence. So thank you. And I think I'm going to stop sharing my screen and sending it back to Dr. Amelia Escolado.
Yeah, thank you. Thank you very much, Dr. Bottazzi. Thank you for a fantastic and informative presentation. I'm sure our audience enjoyed hearing about your unique personal experience as a woman in science and learning about your generous efforts to make accessible vaccines. I'm Amelia Escolano. I'm an assistant professor at the Vaccine and Immunotherapy Center at the Wistar Institute, and also serve as a scientific advisor for our Women and Science program together with my colleague, Jessie.
Thank you, Amelia. And thank you so much, Maria Elena, for a truly informative and inspiring presentation. You have no idea how much we appreciate you sharing with us your work, and especially how impactful that is for, many areas, especially for underserved communities. So thank you so much for your dedication to science. We really appreciate it.
It's a pleasure. It's a pleasure.
Okay, so we have a few questions that were submitted by our audience in advance. So I guess our audience, of course, is curious about your Nobel Peace Prize and your nomination. So they want to know what did this nomination mean to you, and how did this nomination impact your career and your goals?
Well, definitely lots of emotions, right? I mean, when you get this news, first it's even a little bit hard to believe, but I think it highlighted a couple of things personally, but I think as for our entire team, right? It was a validation of our philosophy and our principles, our values, that they're rooted in this concept of certainly equity and doing science to achieve equity. So it was a validation. And why peace, right? Because as you know, if we are lucky enough that we are able to achieve some level of equity in health and access to health, people then, of course, live in better health. They're more productive. Most likely they can get better jobs. They live happier. And eventually you can achieve peace, right? If everybody, has everything that they desire, eventually it leads to peace. So certainly a validation. But on the other side, it's a responsibility, right? So now that we were more visible, that we were recognized, is how therefore we can give back, and how do we give back, right? Not only in my case as a woman Latino in science is, can I be a role model for others, young women, and even, younger generations in general? How can we incentivize the importance of science, especially women in science? How can we advocate for wise evidence, basing decisions on scientific evidence is important. So again, a lot of opportunities, a lot of responsibility that we now have to take more seriously, this aspect of disseminating and raising awareness and dialoguing with anybody and everybody, right? And really sharing your experiences. And so it's just been a privilege. It's just, it's an amazing feeling, I have to say.
Thank you. Thank you, Maria Elena.
Thank you, Maria Elena, and congratulations, because as you said, that has given you a platform to even spread your voice, to more and more broader audiences. We have a few other questions somewhat related to this topic. So if you don't mind, our guests are interested in knowing, why did you decide to provide the vaccine as a patent or license-free? And what recommendations would you have to other scientists that are currently developing new vaccines or new therapies?
Yeah. So certainly it stems from the fact that if you do want to develop vaccines for poor populations where you have to keep the cost low, you don't want to add the barrier that, for example, if I want to give to you my recipes, you have to pay me big bucks for it, right? There's really no, it's counterintuitive, right? Because I would then put barriers of someone saying, I really don't want to, spend my money on that. I'd rather spend the money in leveraging and transferring that, technology into something useful. I think that the reason why it worked for us too is, even though we didn't patent and we of course limited a lot the intellectual property access, the only requirement we really had was, if you allow you to use our information, let us do it with you, because we also wanted to learn, right? So I've never made a vaccine at the 10,000 liter scale, right? In my lab, we make 5 liters, 10 liters. We don't know how to do 10,000 liters of, a vaccine candidate, right? And so then we said, yes, you can use our stuff. We give it for free, but then let us co-develop it with you. So that is really the way we get a return of our investment, right? Of, more knowledge for us, right? That partnership. And I think that for COVID specifically, or even for emerging infections, to be very honest, they happen and they create crises, right? So the last thing you want to do in a crisis is put barriers, because what you really need to is urgently save lives, right? So yes, in a business as usual, we may be a little bit more lenient and say, okay, we have time, it's not like people are really dying, right? We're looking for something long-term, so stay. But in a crisis, you need it now, right? We didn't want to waste time with lawyers. We'd rather, waste time figuring out the science and, and enabling the technology, rather than trying to figure out how to agree on a price or agree on money. So I think, ultimately it was just, a philosophy of global access, to be very sincere.
That's great. Fantastic. Any recommendations in terms of how do we promote more open science?
Well, I think, first of all, you have to ensure your leaders within your organizations agree with that strategy, right? That the way that you want to share, it's something that they would allow you to do, because sometimes you're right, you relinquish some protection, some proprietary, some privacy by open it up. For us, to be very honest, it wasn't too difficult, because again, if I just want to keep it secret, it wouldn't really reach as many partnerships or as many collaborations as possible. So remember, we are in a very unique field, right? Which is already as a neglected and poverty field, right? Maybe the same model doesn't fully apply for big cancer therapeutics or other others, but I think there's ways that you can come up with even a hybrid model, right? There's now ways of enabling this open science where you can limit the open science for what, like we have, for example, many agreements where they say, as long as it's used specifically for neglected tropical disease initiatives, you can get better prices or better negotiations when we, for example, want to access technology from a private company, for example. So you have ways of how to negotiate that.
Thank you, Maria Elena. So I think our audience is also interested in your particular experience as a woman in science. Like, could you tell us a little bit about what led you to be a scientist, and how do you think we could attract more women to the scientific career?
Yes, well, certainly the first thing is my own self-initiative, right? I mean, I think, as I showed you in my first slide, I really valued understanding who I am, right? Understanding your strengths, your weaknesses, your interests, which really come also from, your family, how you were raised, the exposures. Like me specifically, I'm an Italian born. My dad was a Honduran diplomat, and then we moved back to Honduras. I was very little, but I think that exposure of living in a country like Honduras, growing up also with a family where, my family was a cattle ranching family. So we used to go in the remote, rural, outside of the capital city, so seeing, all these childhood experiences not only made me understand who I was, but of course, my personality, but then also my interest. So that's point one, learning who you are, understanding your strengths, your weaknesses, and your what really builds that curiosity. The second was, of course, the ability of creating networks of people who were genuinely, interested in helping you, right? Positive mentoring, advising, peers, right? I had great professors from not only my, school, but in the university in Honduras, when I came to the US, and forge and create a network, right? That really can tell you, this is my view of, the options that you could do, so really, so that I could have a dialogue with people more experienced than me, peers, and even just, seeing the opportunities. So that's two, the networking. And three, I think for me specifically is sometimes not only as women, we already think that we are less, so remove that a syndrome of, I cannot speak because I'm in a room all full with men, and therefore my voice is not going to be heard, right? Or I'm a woman, and in fact I'm a woman who has partnered with Dr. Peter Hote, so we have been a pair, right? We have been a duo for 20 plus years, and really enabling the fact that sometimes I may be shadowed behind, and not be afraid to really highlight that you're equals, right? That you're building that equality. So I think that voice and that removing of all these perceptions of not only women in science, that when you are with other groups that, that you feel yourself, that you're less, that, the typical imposter syndrome kind of, and I think the last is cultural intelligence, right? That, we also always think that, oh, because I studied in Honduras in a university that is from a poor country, that I may not have the best quality education, or the fact that I'm Hispanic, I'm at a disadvantage. And in fact, the fact that I speak multiple language, that's certainly an advantage for me. The fact interact with groups and I can understand the cultures, right? So, really capitalizing on that cultural intelligence, then makes you understand better, where others come from, right? How you can dialogue and say, oh, you have these beliefs, and your beliefs and your values drive the way that, you value, certain activities in your life, right? And so understanding that dialogue is very important. So your personality, creating networks, speaking up, your voice, and then maximizing your cultural roots, right? And it can be anything, right? Even, the way that you're raised.
Thank you, Marilena. That was definitely very inspiring and I hope helpful for many of us. So I think we have a lot of other questions. Probably we can just send them to you later, but for the sake of time, I think we should wrap up. But yeah, thank you so much again for a fantastic presentation. It was great to hear about how everything started and finally derived into this vaccine that you kindly provided with open access. So thank you so much. Thank you for being with us. I'm sure our audience found your experience and all the information really useful. So thank you very much, Dr. Bottazzi. And with that, in closing, please save the date for our next Women and Science program in November, where we will be presenting Dr. Corey Bergman from the Rockefeller University with our Helen Dean King Award. Thank you for joining us, and we hope to see you at our next event. Have a good evening, everyone. Thank you so much for joining. Thank you.